Health alert tonight. Cases of the new deadly coronavirus have surged over the weekend, rising from 62 to more than 200 people affected.
And a third death has now been reported. Our chief health editor, Dr. Nandi, joins us now. So, Doc, with the number of cases actually spiking, is this because the virus is spreading fast?
So, Alan, there's still a lot to learn about this new coronavirus, also known as 2019-NCOV, but we believe it's something that's not spreading easily, and that's because of two reasons. One, Chinese authorities say that there haven't been any spread to healthcare workers taking care of those infected, and two, there haven't really been any ongoing spread to the virus into the community. That's not to say it can't happen. It's still possible that there could be some limited person-to-person spread. But the rise in numbers is likely because officials are actively looking for new cases and testing those who are ill.
So can you explain more about this virus?
Sure, Heather. Coronavirus it's a large family of viruses, and 7 types are known to infect and sicken people. Usually, it's mild to moderate upper respiratory tract illnesses, and you're likely familiar with one of them. That's the common cold. But some coronaviruses can cause serious health issues like pneumonia, kidney failure, severe acute respiratory syndrome, even death. And the danger with coronaviruses is that they're zoonotic, which means in English that they can be transmitted between animals and humans. It's rare, but we've seen this before with SARS and MERS. Now, it's not for certain that this new coronavirus is a zoonotic, but it's possible since many of those infected visited a large seafood and animal market in Wuhan City, China.
So, Doc, what is the likelihood of this virus actually spreading because it's spreading so quickly? And more importantly, what can people do to protect themselves?
That's a big question, Alan, right? So here in the U.S., the CDC is closely monitoring the outbreak, and they're screening flight passengers on flights from Wuhan, China at 3 airports. At this moment, the health risk here is considered to be low. But when it comes to germs, it's always good to protect yourself and your loved ones. So I want to remind you again, please wash your hands frequently with soap and water. Avoid touching your nose, mouth, and eyes, and cover any coughs and sneezes. But we'll keep track of this virus and give any updates as they come along, okay?
All right, thanks so much, Doc.
My pleasure.
And if you have a question or a health concern for the doctor, you can email him, Dr. Nandi, at askdrnandi.com, or be sure to send it to us on Facebook or Twitter.